It's now my pleasure to welcome our next speaker, Dr. Renzo Ginto. He wears many hats, some of them are listed on the program, so I'm not going to read out all of them, but there are a couple of things I want to highlight in introducing you, Renzo. First of all, Renzo is a medical doctor. He's also passionate about building climate-smart local health systems. I didn't tell you I was going to introduce you this way, Renzo, but your Twitter profile describes you as a public health storyteller. So I'm hoping you're going to tell us a story or two about your work and why you're so passionate about this area. Over to you.
Thank you very much. Dr. Kasai, Your Excellencies, colleagues, and friends, good morning. Thank you, WHO WePro, for this wonderful opportunity to share with you a perspective from the next generation of health professionals. This year's theme, World Health Day theme, Our Planet, Our Health, holds a special meaning for me. As a physician and public health specialist from the Philippines, I witnessed firsthand the devastating effects of the climate crisis and other forms of environmental change on human health. Injuries and deaths resulting from typhoons and intense flooding, outbreaks of dengue and other infectious diseases, respiratory diseases caused by exposure to air pollution, the increasing salinity of drinking water as a result of sea level rise, the growing climate anxiety, especially among young people, and much more. And all of these are happening on top of the ongoing COVID-19 crisis, a disease that reminds us that how we relate with nature, with animals, and other life forms does shape our health in return. And that is why, early in my medical career, I decided to embrace the powerful concept of planetary health as a compass for my work in medicine and public health. In this era of planetary health, we now have two patients, not just people, but also the planet as well. The health of people and the planet are inextricably intertwined and inseparable. The indigenous communities of the Western Pacific region have known these for centuries. Today, what we are seeing is that the serious damages that we inflict on Mother Earth through our myriad human activities are coming back to us in the form of human disease and environmental disaster. We must therefore cut this vicious cycle of degradation and disease and instead activate the virtuous cycle of healthy people and healthy planet. And we must activate this cycle not tomorrow, but now. And as Dr. Kasai has just mentioned, we cannot wait until COVID-19 is over. The planet has imposed on us some limits and deadlines. For instance, the 2030 deadline of the Paris Agreement. And if we fail to respect and meet them, then there is a very high chance that the catastrophic impacts of environmental change on human health will become irreversible. For instance, there's actually one recent study estimating that if climate change will not be averted, we can anticipate up to 83 million deaths worldwide occurring by 2100. That means the consequences of today's pollution and inaction will be borne by many people from my generation in the coming decades. And that is why I and my fellow colleagues are doing our part to safeguard our planet and our health. In St. Luke's and Sunway, through education, research, and advocacy, we are preparing the next generation of planetary health citizens who care for both people and the planet. We are also working closely with health professionals, hospitals, and health systems to build climate-smart healthcare. Climate-smart healthcare is at the nexus of climate mitigation and adaptation, of sustainability and resilience. We need healthcare that does no harm, not just to patients, but also to the planet, by embracing clean renewable energy, green procurement of medical supplies, environment-friendly waste management practices, among others. But we also need healthcare that is adaptive to the health impacts of climate change, that bend without breaking, with a ready workforce and stable supplies, as we must be the last sector standing when climate disasters strike. In our work, the toolkits that the WHO has developed over the years have been a reliable guide. And so in closing, I invite you all, from now on, let us embrace the planetary health approach for ourselves and for future generations. And I just want to re-emphasize what Dr. Kasai mentioned. What we want to happen is that a century from now, the children of 2122 will read the history books, will look back to the past, and they will say that the COVID and climate generation of 2022, which is all of us in this room, have been good ancestors to them because we made the right decisions, not just for ourselves, but for their health and well-being as well. Together, let us advance planetary health, our planet, and our health now. Thank you.
Thank you so much, Renzo. We could not have asked for a better voice of young people, passionate, articulate, and despite the huge challenges we face, hopeful. Thank you very much.